arthroplasty. As a result of his arthroscopy, he underwent an arthroplasty procedure to restore the joints in his knee. His arthroscopy showed that he had a small tear in his right leg joint. Gastralgia. He suffered for several years with violent gastralgia. Tracheostomy. He had a tracheostomy for breathing. Rhinorrhea. She has reported periodic rhinorrhea as well as a mild cough as her symptoms for the past 3 days. Hemostasis. An endoscopic hemostasis was difficult. Sigmoidoscopy was performed. Rhinoplasty. Rhinopathy. The doctor diagnosed me with a rhinopathy, a disease of the rhenia caused loss of vision. Adenopathy. He has no evidence of rhinopathy. Adenopathy. He has no results of sarcoma or other benign causes of adenopathy. Hemolysis. Her blood work showed she had hemolysis caused by parasites. Ostomy. In efforts to relieve his arthritic pain, the doctor prescribed her patient to undergo a ostomy. Bronchoscopy. The doctor will perform a bronchoscopy to look into your lungs and airways. Dysphagia. Kim has been experiencing symptoms of dysphagia for the past few weeks, causing her to miss work. Dyspepsia. Kim's gastroenterologist decided to order an upper GI due to her complaints of dyspepsia. Pancreatoma. A lab result came in showing that Jim had pancreatoma. Gastroenteritis. Jordan's afflictions was diagnosed as a virtual gastroenteritis. Colopathy. The patient's blood work showed a mild case of colopathy. Her doctor recommended B-block therapy. Colopathy. The patient's blood work showed a mild case of colopathy. Her doctor recommended B-blocker therapy. Pancreatomy. After his diagnosis of pancreatic cancer, Jim's doctor advised him to have a pancreatomy. Cerebrotomy. The doctor performed a cerebrotomy on the patient to see what cerebral damage was caused by the aneurysm. Narcoplasty. She is a continuation of mine, and her case is typically the problems faced by narcoplasty sufferers. Analgesia. Covering for her surgery was a breeze due to her analgesia. Atelectasis. Thomas was admitted to the Toledo Hospital after suffering from atelectasis. Ischemia. Reducing Myocardial ischemia has been observed in patients' therapy. Diaphoresis. The patient has avoided outdoor activities out of embarrassment to his diaphoresis condition. That way, no one could see how much she sweats. Esotropia. After her eye exam, baby Josie was diagnosed with esotropia, which explains why her eyes turned inward. Gastroplegia. Applications of gastroscope in the astroplegia treatment after a large part of the stomach resection. Colic. Dr. Smith explained that the patient's abdominal pain was caused by colic found on his ultrasound. Oliguria. She developed acute oliguric renal failure and multiple electrolyte abnormality. Petechia. Multiple petechias were observed in the mucus and in the skin. Dyspnea. Many soldiers performed with acute dyspnea. Orchiectomy. The surgery is performed as treatment for testicular cancer.